Hillary, on health care, the stakes are high. The stakes are very high. What are the stakes for minority Americans, particularly African Americans, on health care?
They're among the highest. Quite frankly, a lot of the debate is over how we make sure that people that have insurance now are able to be fully covered and not get gouged through the process. But there are over 46 million Americans that have no insurance at all. So those who have no insurance are those that are most vulnerable. They're those that are most dependent on some of the programs that are here or have no programs at all. So the African American community, a community in which 30% of the 46 million Americans that have no health insurance are included, very well needs good health insurance, good quality, comprehensive health care coverage.
If this does not pass, we understand that it has implications down the road for the Democratic Party. There are 50 marginal seats in Congress that could be affected, as well as the presidential elections. Could you talk about that?
Absolutely. Because it's such a high stake, so many Americans are engaged in what happens in this process. It means that those that are engaged in passing the legislation, those 435 members of the House that are all up for re-election, of course, not to mention the kinds that are more vulnerable, blue dogs, and so forth and so on, but also 1/3 of the Senate is up for re-election as well. All of those seats could be affected by what comes out of the success or lack thereof of this health care initiative.
Now, James Clyburn, the House Majority Whip, said that these town hall meetings are civil rights demons. You in the civil rights sector at the NAACP, what say you about this? Race has been invoked, has been brought into these meetings. Why, and what are your thoughts?
Well, it's outrageous, quite frankly, and deplorable that in what should be the most democratic of sessions that happen in our country, the most sacredly democratic process in which the American people are engaged in talking with their elected officials about what they need them to do on an issue as important as health care, is being disrupted by those that don't even want the discussion to happen at all. That, quite frankly, is a form of extremism that no one should stand for. We should all at least support the importance of being able to have a civil conversation about what our public policy should be in this democratic society we call the United States of America. And Mr. Clyburn is right to a great extent. And that is to say that if we think about it in terms of actual civil rights, the civil right to be engaged in the electoral process, to be engaged in the functions of our government, the "we the people" clause of the Constitution of the United States is very much jeopardized when we're unable to participate in this process.